Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Lanette Siragusa, Chief Nursing Officer and Provincial Lead of Health System Integration and Quality for Shared Health. We are announcing three new deaths to COVID-19 this morning. A male in his 70s from the Southern Health Santé Sud Health Region, a male in his 90s from Southern Health Santé Sud, and a female in her 80s from Winnipeg Health Region and linked to the outbreak at Victoria General Hospital. To extend my condolences to their family and loved ones, as well as all those individuals whose deaths were announced over the weekend. The current 5-day COVID-19 test positivity rate is 9.5%. 365 new cases of virus have been identified as of 9:30 a.m. this morning. And this brings our total confirmed lab cases in Manitoba to 8,495. Some update on our outbreaks. Parkview Place has a total of 152 cases, 37 staff and 115 residents with 23 deaths. Maple's personal care home has a total of 177 cases, 55 staff and 122 residents with 13 deaths. Victoria General Hospital has a total of 68 cases with 35 staff and 33 residents with 8 deaths. Headingley Correctional Centre has a total of 183 cases, 37 staff, 146 non-staff. So we can see that in just 1 week, we've announced more than 2,000 cases. So we see these numbers going in the wrong direction. We see increasing demand on our healthcare system. And we're at a critical point where we need to change these dynamics. I know that when we see these numbers, many people are worried. I know our healthcare workers are quite concerned about the increasing demands, and it's understandable given these numbers. We're in a pandemic, essentially a 100-year pandemic, and so these are concerning times. We know this won't be forever, and we all know that we have that ability to shift things around. I know Manitobans, we have that strength, we have the ability to turn these numbers around quickly. We've done it before, and we know exactly what we need to do. We have that responsibility to protect our most vulnerable, to protect ourselves, the people around us, the people we love, our community, the most vulnerable people in our communities. And that's why over time we've needed to put more restrictions in place. I've met with the Premier this morning to discuss the need for further restrictions. And nothing has been off the table, and we'll continue to review those options as we look at these numbers. We still have significant restrictions in place, and we're looking to see the results of having those in place. But at the same time, we're looking on whether further restrictions are going to be required. So we're going to have more information on that as time goes on. But we're certainly concerned with these numbers. But at the same time, we all know what we can do to make a change in relatively short order. And it all comes down to reducing our contacts. We need to reduce our contacts outside our household. And that means staying home for the most part, leaving for essential purposes, if possible having only one member of our house go for essential purposes. And we need to avoid gathering. And so we know Remembrance Day is coming up this week. And obviously such an important day in our history to show respect. But we need to do things differently this year. We can't gather. We'll be putting many people at risk if we get together in large gatherings. So we need to find creative ways, virtual ways to do this. And really need to reduce the risk to all of us, to protect the most vulnerable, to protect our loved ones, to protect our healthcare workers. And so it's, again, when deciding to go out, at least in the near future, you need to ask yourself, do you need to go out? If it's an essential reason, if it's to go to work, then if it's for essential tasks. But if it's not something that's essential, do you really need to do it at this time in the short term? We've talked again about businesses. If virtual working from home is a potential, if it works out, then that's something to be implemented now. We've talked about being kind, being respectful to others, and we've heard numerous accounts of now employees at businesses, operators of businesses being harassed by the public for just simply trying to do their part to protect Manitobans. We have restrictions in place and they're tough, and we hear that, we know that. But we can't harass other people for trying to do their part to limit gathering sizes, to enforce occupancy restrictions. We are all this in together, and we're all trying to do our best to turn these numbers around. We can't continue along the same course as what we are, because we can see the effects on our healthcare system. So please be respectable, and realize that we're at a difficult time for everyone. This is a difficult time on businesses, difficult time on employees, difficult time for Manitobans. So we all need to work together at this. And again, it's the short term, but this is a critical time right now. Again, some of the same messaging about trying to skirt the rules or getting around the rules, which are there to protect everyone. So we know that right now, the Winnipeg region, the southern region, Santé Sud region, are under restricted areas more so than certain other areas for the time being. So we've heard of people leaving those areas to go have large gatherings elsewhere. And so again, this is not the spirit of the order. The spirit of the order is that we need to do things that are essential right now. We don't need to find ways to gather, right? When you do that, you're not only putting yourself at risk, you're putting Manitobans at risk. You're putting our healthcare workers at risk. So please understand that the goal right now is to reduce your contacts. So we've received, numerous, petitions from sectors, from businesses to open things up, to allow certain businesses to open longer or for more gathering. And it's very understandable. I think all Manitobans understand that these are difficult times, and not really calling anyone out in particular. It's challenging, but just not what we need right now. We need to decrease our contacts, and we need to do so now. So we can't be looking at ways to expand things, expand ways people can gather. We need to reduce ways for people to gather right now. So it's an unprecedented time. It's changed all our lives, the way we live right now. And it is going to be for that short term. But we need to do it now. We need to change these numbers. And we'll see as time goes on, we'll be able to get back to the things we love. But right now we need to focus on bringing these numbers down, protect the people around us. So again, I know Manitobans, we're going to step up. We're going to flatten this curve once again. And in the future, we're going to look back on how we all came together to do this. But we're, for the time being, we need to change what we're doing. And we're going to see those numbers change in relatively short order when we all start stepping up again. So thank you again for the work of all Manitobans, and I'll pass it over to Lanette.
Thank you. Good afternoon, everyone. As of midnight, 80 of 85 ICU beds were in use, with 28 of those beds occupied by COVID patients. 21 out of 69 patients on ventilators this morning were COVID positive. We opened 2 more ICU beds over the weekend. Both were at the Health Sciences Center. And since the end of October, we've opened 8 additional ICU beds as part of our efforts to flex up the healthcare system to have capacity for these high numbers of COVID-related hospitalizations. Since October 26th, 397 non-urgent and elective surgeries have been postponed as part of our slowdown efforts. Medicine beds, meanwhile, are hovering around 80% occupied this morning. And outside of Winnipeg, that number is a little bit lower, around 65% occupied. Acute care hospital capacity will continue to be increased in stages as needed to respond to the health system's needs as part of our overall planning. I can also provide a weekly update on the numbers of positive cases involving healthcare workers. I want to start by letting you know we heard the sad news this weekend that one of our own has fallen. A healthcare worker passed away this was in association with the Victoria Hospital outbreak. So we want to extend our condolences to his family, loved ones, and the team. In the past week, 44 healthcare workers across the province tested positive for COVID-19. 1,707 healthcare workers and first responders were tested for the virus in the past week. The 44 positive tests include 36 from the Winnipeg Regional Health Authority, 5 from Southern Health, 2 from Prairie Mountain Health, 1 from Northern Regional Health Authority, and 0 from Interlake Eastern. Broken down by profession, this past week's number includes 22 nurses, 4 physicians or physicians in training, 15 allied health or support staff, and 3 have yet to be identified. Since the start of this pandemic, 403 healthcare workers and first responders have tested positive for COVID-19, and this includes an additional 79 cases that were added to the count this past week. And these older cases that are now being added are following a data backlog. So as we get more information on that, we'll continue to update. 25,888 tests of healthcare workers and first responders have been completed since the start of the pandemic. We are continuing to see increased sick time among healthcare workers. In the Winnipeg Regional Health Authority, over 106,000 hours of sick time were used in the most recent 2-week period. This is about 27,000 hours above the 5-year average for this time of year, and it's also a significant increase from the previous 2-week period when about 92,000 hours of sick time were used. The increased number accounts for those who are isolating after exposure and those who have symptoms and are unable to work. And it's obviously a great concern for our healthcare system. It is for this reason that we have introduced rapid testing at Health Sciences Centre using the RotoGene. And as previously shared, this testing is for staff with mild symptoms who are scheduled to work within the next 72 hours. And the testing allows us to determine within 4 to 6 hours the results for these staff. And those who test negative for COVID-19 may be cleared to work their scheduled shift. The site at HSC is now supporting the same form of rapid testing for staff with mild symptoms at St. Boniface Hospital. Work remains underway to expand rapid testing access for our valued health workforce. Finally, we are continuing to encourage patients who arrive at the hospital to be honest with our screeners. I know most of you are, but I just don't want you to fear that you will be turned away. This is just a process of making sure that our staff have the adequate PPE to be able to provide the right services for you. We also noted a couple of weeks ago, there was an example of a surgical team who had to be isolated for 2 weeks following a situation where a patient was not identified as a contact and then later turned out positive. So I can report that all members of that team were cleared to work, back to work on Friday. And we're very happy to know that they're healthy, and we welcome them back. The protection of our staff is a top priority. So too is ensuring that we have the appropriate staffing in place to support a high standard of patient care. As the number of surgeries performed slows down across the healthcare system, we are preparing to redeploy staff who normally work in our surgery program to slightly different roles to support additional demand on critical care and medicine. This, of course, involves familiarization and orientation efforts to ensure that staff are comfortable with the tasks, the processes, and the responsibilities, particularly as we look at team-based models of care. Orientation has begun today at the Health Sciences Center, where surgery staff are in the critical care unit today doing their familiarization and some skills training. As discussed last week, we will be relying on increased workforce to support medicine and critical care. We have identified that there are more than 600 nurses who have completed the critical care training program. And while we have awareness of where these staff are currently working, we are asking any of these staff who are interested in redeployment to work in critical care. We're asking them to identify themselves to the Provincial recruitment and redeployment team so that we can work with them and prioritize their orientation. We continue to bring on additional workers with 405 individuals hired into the COVID-19 casual pool since April. That includes 53 people, including 35 nurses hired in the past 3 weeks. We continue to hire, and there continue to be opportunities and positions for every type of healthcare worker. We continue to encourage healthcare workers who have retired or who haven't worked in some time to join the fight against COVID. There's tremendous opportunity for people to work to their full scope of practice with training and support within a team-based environment so that overall needs of the patients are addressed and you're working in a safe environment. So we would welcome you to please join us. We very much need you. And we also want to express our gratitude for an overwhelming response that we had from our laboratory partners in Winnipeg last week, who stepped forward on a moment's notice to donate pipettes. After the call went out, researchers from multiple labs came together and left boxes of the tips for pickup. Some didn't even leave a name for us to call them back and properly thank. So if you're out there, we thank you. These donations, combined with our alternative supply sources, helped ensure that there were no service disruptions while we worked with our procurement team to identify additional suppliers. So thanks to everyone who stepped up to donate. Thanks to all our teams for continuing to do what you do. And at this time, we can open up the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions. Up first this afternoon from the Canadian Press, Steve.
Dr. Roussin, you said this is putting an increased demand on the healthcare system, and we're at a critical point in time. I see ICU beds are still running, above 90% capacity, even with some added in recently. Did you expect the numbers to start dropping at this point? We're still seeing hospitalizations going up and near record daily case counts. Were you expecting numbers to drop at this point, given the restrictions you imposed a week ago and change?
So we'd just be on the cusp of that. So just at this point here, 7 days in, this is where public health would really want to start seeing some changes. Certainly the big effect of it is that full incubation period in, so by the end of this week. But you know, like I say, we're really at a critical juncture right now. So we're still, nothing is off the table as far as further restrictions that may be required.
And can you let people know what those further restrictions might be? There's a range available under the restricted red code, including closing non-essential businesses, I imagine is one, but could you let us know what is on the table?
Yeah, well, I mean, nothing is off. Certainly, we know that right now we have a number of non-essential businesses that are still allowed to operate, albeit at very limited capacity. And so that's something that we'll have to look at. We haven't, there'll be more to come on that when a decision is made. But you know, my advice was sought this morning on what further restrictions should be in place, and we're in the process of deliberating. And so there should be more to come in the near future on that.
Okay, and I'd like to get your thoughts on the status of residents at the Maples care home. Paramedics responded. They spent hours there. Among the many tasks they performed were hydrating residents with IV. What does that tell you about the level of care provided at the home if people were that dehydrated? Does it raise any red flags with you?
Well, I think that situation has you know, raised a lot of red flags, and as the minister said, we're going to be getting answers for that. We want to look into it. So certainly we've heard you know, heard reports from this. We've heard reports from the operator as well. And so we're going to get clear answers on just what that is, and so you know, I can't conclude on anything until I see those results. But I'd say it's clear that no one would accept a lower level of care for our most vulnerable Manitobans. So we're going to have answers. The WRHA is going to be providing more answers on things going forward to ensure that we're not going to see any issues. And so I think there's more to come on that.
From CTV News, Michael.
Hello, yes. I'd like to address the letter sent to the province sent by nurses outlining concerns that they have and actions that they would like to see taking place. This question is to you both. Have you read the letter, and if so, what actions are being taken to address the concerns outlined therein?
So yeah, I've read that letter. I've read the letter from physicians that were sent as well, talking about more restrictions. And I think, you know, I think the message is good overall. That, you know, more needs to be done as far as restrictions, as that we're at a critical juncture. Because, like I say, we're receiving those letters from physicians and nurses and other healthcare workers at the same time that we're receiving letters of petition. At the same time, we're seeing rallies against restrictions. So I think it's very important to have the support of our healthcare workers in the front line, you know, supporting and letting Manitobans know just how important it is right now that we change our behaviors, that we change our actions. And then, you know, on top of that, the type of restrictions that are listed are, you know, are things that have never been off the table, things that we've had in the past in our restrictions, things that we're deliberating on now. So I can't provide any specifics, but I think that, you know, having that support from healthcare workers, letting Manitobans know just how critical things are right now, that we change things, which will likely require further restrictions, because you know, we receive as well also the issues from businesses that we know it's quite difficult for them, these restrictions, but I think it's clear that we've come to a point where things are quite critical.
Okay, and then my second question is, we received some notices from viewers about wait times on HealthLinks exceeding 7 hours. So is that service at overcapacity? And what are the average wait times? Is that normal for someone to be on hold for that long?
Yeah, 7 hours seems excessively long for sure. We have the average wait time being 162 minutes, which I would say is also too long. But we are making efforts to improve that access. So there have been 200 more call lines put in through HealthLinks. There are 15 staff who are being hired or being trained in process. The goal is to have 30 more staff in there to help out. We are hoping that people, as much as possible, are going to the patient portal to check their results, but I understand that there's other reasons as well to contact HealthLinks. So they're making every effort to manage the calls. They are becoming a little bit more complex, some of the phone calls that they're receiving. It's not just a test result, it's some problem solving, so sometimes those calls take more time. But we are adding more resources to meet the demand.
And then, Ms. Siragusa, last Friday, you kind of mentioned part of the plan to escalate critical care capacity. It's basically reopen closed spaces in hospitals that had previously been critical care units. Does this, in effect, mean shared health is reversing consolidation?
Reversing consolidation. No, it's not. We still want to have the ICUs located at the sites, HSC, the Grace, St. Boniface, and Brandon. So they will continue to be consolidated at those sites because it just works more efficiently in terms of staffing. So the beds will be located there. The other sites, the Vic, Concordia, Seven Oaks, are intended to remain low acuity sites to support the places where the sicker patients are when they can move down to a different level of care, that those resources would be there. So no, it's not reversing consolidation at all. It's actually building from what was done previously.
From City News, Jonas.
Good afternoon, folks. Ms. Siragusa, first question is for you this afternoon. When we discussed the availability of ICU beds right now in the province, we had received a note this morning that availability is in Brandon and Winnipeg is full. Can you expand on where the availability is and if this is correct?
No, I think there is capacity in Winnipeg and Brandon. It's not a lot of capacity, and the critical care teams are working on expanding right now. Certainly we are feeling, and we expected to feel, the constraints right now, about 7 to 10 days following October 31st, when we had quite a high volume of active cases. So bed expansion is happening as I speak in Winnipeg. Brandon, I think we have a different process of which beds will be opening when, depending on the capacity and the footprint of the hospitals. Not every ICU has the potential to expand. But so we'll be working with the team, the critical care team. They are meeting every single day to look at who's coming in and what are the needs and the staffing situation, so that they can proactively make the decisions and build capacity.
Thank you for that. And as a follow-up, Ms. Siragusa, I guess just as confirmation, as of that midnight time, how many of those available ICU beds in Winnipeg were open?
Were what?
Were available. Sorry. How many available ICU beds? Five? Thank you.
As of midnight, yeah.
I appreciate that. Thank you very much. Dr. Roussin, follow-up for you question here. We are hearing from seniors advocacy organizations, and they are saying that Manitoba or maybe this is for Lanette, I'm sorry, guys, but whoever can answer this would be great. They're calling Manitoba one of the least transparent jurisdictions in the country. And just want your response on the system and the transparency.
Yeah, I'm not sure. I mean, I think I'd have to hear about what the specific concerns are. You know, I think that since February, Lanette and I have been here multiple times a week answering, you know, questions that are posed to us. Our dashboard is fairly robust. So I'm not exactly sure on where the transparency is being felt to be lacking, but you know, I think we've put in a lot of effort to be transparent to Manitobans to provide that information.
Dr. Roussin, I'm not sure if you can hear me. Sorry, I apologize if that wasn't clear. This is specifically referring to long-term care homes and inspection reports.
Yeah. So I'm not sure. Like certainly our outbreak reports we provide. You know, whenever there's an outbreak and what's and the numbers consistent with that, we're reporting the severe outcomes with it. And so I'm not sure, Lanette, if you had anything further to add on that.
Yeah, I would say our goal is to be transparent. We sit up here multiple times a week. If there are specific things that would be helpful for us to share, we certainly would be open to hearing that, and we will definitely see what we can do.
From CHVN, Taylor.
Hi, good afternoon. Is there a provincial regulation regarding how many healthcare workers to patients are needed? Not talking about hours of care, but specific people.
Yes, there is. It's called hours per patient day. So what it looks at is the acuity, the level of the patient, and what the mix of provider is to support that patient or that group of patients. So it may be a combination of nurses and HCAs, healthcare assistants, and based on the acuity of the patient, the model of staffing is built to support that.
Why is it based on hours instead of staff?
That's a good question. I'm not sure who made that decision, but I think it gives some flexibility in terms of if you need to staff up more for nursing on one area or more for healthcare aides on another area. It's meant to be flexible, but it's a target for to set and to have some consistency among the both personal care home and acute care.
And if a healthcare worker does not want to work at a place with an outbreak, what is the province doing to give them the choice to or not to?
Well, there is the option of accommodation. So if there's a reason that they can't work because of maybe they're immunocompromised or there's a health reason why they can't work, then we would definitely have that conversation about where can we move you so you can work in a different environment. But if the healthcare worker is assigned to work at a specific location, then it's our job to make sure that they have what they need to feel protected and safe, whether that is PPE, whether that's mental health support, whether that is additional staffing to manage the workload. So we would work with that individual to help support them at the site where they're at.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. This is Danielle De Silva from the Free Press. Dr. Roussin, my first question is for you. Why are the for-profit personal care homes in Winnipeg, including those operated by Rivera, which is also at the center of a class action lawsuit in Ontario, experiencing such severe outbreaks when nonprofit care homes seem to be able to better manage the spread of the virus in their facilities?
Yeah, well, I mean, I think that there's been oversight at all those levels, whether it's for profit or non for profit, through the region, And so there's investigations that go on with the outbreaks, there's support. So we'll really have to, when we talk about Maples for sure, we're getting answers going forward on what exactly occurred there. And going forward, the region has the oversight. They are providing that type of support to these areas. So we'll have to gather further information as time goes on to see. But our typical outbreak measures are in place in these areas. The provincial policies are in place, and so I can't really speak specifically on that distinction. But I do know that the regions are heavily involved with these care homes.
Okay, thanks. And I guess that's my follow-up then. So what does it say about the level of care and competency of the for-profit personal care homes in Manitoba when more than 3/4 of all of the province's personal care home cases are in residences that are operated for-profit?
Yeah, I don't think I can provide a conclusion on that. I think that there's more to come on that, as was discussed yesterday. And still ongoing work, with the regions.
Okay, thanks. And my last question is for Nurse Siragusa. An out-of-province home care provider is recruiting nurses and healthcare aides from Manitoba and advertising positions in Ontario with compensation that outpaces what Manitoba offers, plus the settlement bonuses. What is your reaction to employers headhunting for workers in Manitoba? And what is Shared Health prepared to do to retain staff?
Well, I don't like that at all, but I don't know about it. So you know what? I'm going to look into what that is and follow up. But we certainly want our healthcare workers to stay in Manitoba, and we'll have to look at what's being offered and manage that.
From Global, Brittany.
Good afternoon, Brittany Greenslade from Global News. My first question is for Chief Nursing Officer Lanette Siragusa. Lanette, you sat up here this weekend when the Maples Care Home outbreak and the condition that happened there Friday night, the incident there. We're now hearing from WSPS Chief Lane that a similar incident happened at Parkview Place. Were you aware of that, and can you give us the information surrounding that particular incident?
No, I was not aware of that. That must have happened through the WRHA. But the issue with the Maples, I was notified by the Emergency Response Service on Friday evening. So it wasn't brought to my attention, but I certainly will follow up.
Thank you. And if this is the fact that we've had two very similar incidents, this one obviously being taken very seriously at the Maples, was only brought forward because of a paramedic who posted it on Reddit. Is that how the public should be getting their information about very serious incidents and multiple deaths within a 48-hour time period with our most vulnerable?
No, absolutely not. If there are issues and concerns, I mean, it has to be, we are trying very hard to be transparent. We try very hard to make sure that the public and our providers get information as soon as we have it available. But it is, there's communication processes that have to be in place. And obviously, I mean, we're going to have to look more into what happened at the Maples and if the same situation happened at Parkview. That's part of what I think this investigation is about, so that we can really determine what's the root cause and be proactive. Like, the worst thing is to have to deal with a situation where there's multiple 911 calls and if there's an opportunity to see something coming and build capacity and resources in preparation, then we want to be able to do that. Our citizens deserve that. So we'll have to wait until we see what the investigation comes up with, and if there's recommendations for improvement, we by all means will embrace them and implement them.
Thank you. And my last question is for both of you. Do you both feel like you're being briefed enough and clearly enough on what is happening inside our long-term care homes? And do you think this latest investigation, once it's complete, should be made public, all of the findings?
Well, as far as the investigation, there's I can't really comment on that. I'll leave that to others who will be leading it and on whether it's should be disclosed or not. As far as briefing goes, I think it's we've continued to learn as this goes on. I would say that the events on Friday certainly. Lanette, me or Lanette were given, any notice that there was concerns going on prior to hearing about the urgency in the evening. But I think that again, there's processes in place to improve that, and I think going forward we'll likely see the better reporting on that.
Mm-hmm. I agree.
From the Brandon Sun, Michelle.
Yes, hi there, Dr. Roussin and Lanette. My first question has to do with numbers and what are the triggers to move into red for Prairie Mountain Health, for example? Like, when do you feel it's necessary to stamp down?
Yeah, and so we've always been talking about that there isn't a single indicator. There's multiple indicators, there's trends. So we look at that test positivity. We look, of course, at the absolute case numbers because we know that translates into admissions and ICU admissions. And we also look at where we are with our healthcare system. And so seeing those type of trends, it's we're looking at likely more restrictions are in order because we're seeing those all trend in the wrong direction.
Okay, I'm just looking at our path here in Brandon. We sort of trended upwards before the rest of the province, and restrictions were put in place. We brought the numbers down. So I'm kind of seeing a scenario where we wait till the numbers rise again before we actually become active in trying to flatten the curve. So, how do you find that balance?
Well, it is a balance, and there's a number of things to consider. One is we really want that targeted approach with the restrictions, both geographically and with the sectors. What we're seeing now is with the sectors, at least, we're seeing widespread community-based transmission, so we don't have that opportunity to target because we can't see just certain areas. It's widespread. And then geographically, we're seeing certainly areas in the province that are trending worse than others, but all are trending in the wrong direction right now. And then we see issues with geography, like we've heard of people leaving say the Winnipeg region and going to a region such as Prairie Mountain Health in ways to skirt the restrictions that are in place in Winnipeg. So sometimes that targeted approach will have these unintended consequences, and we know that no matter where cases occur, they will, a proportion of them will add to the strain on the healthcare system. So moving forward, we really need to ensure transmission is limited everywhere in the province at this point.
So I'm wondering, because of the situation that happened on the weekend with the care home, are there specific plans to protect care homes in other regions, such as Prairie Mountain Health? Or, Lanette mentioned, do we have to wait for the investigation? And, do we have time to wait for an investigation in order to help protect these homes? Or?
We do not. So recommendations, we're looking forward as to where the gap was with this situation. Obviously, there was a gap, and I think there's probably going to be learning opportunities. So that we are looking forward to, but that absolutely does not take away from our ability and desire to make sure that this doesn't happen again. So in the spring, we watched very closely what was happening in Ontario and Quebec. We took the recommendations from the Public Health Agency of Canada as to how do you keep your personal care homes safe. staffing, PPE, environmental cleaning, all those we worked through with the regional health authorities. They were shared with the PCHs, both public and private. So that's happened already. As well, the same work that I was talking about last week with acute care and surge planning, like capacity building, we also did the same work for long-term care. So if outbreak is declared, we do need to talk about additional staffing and who's doing what skills and what does a model of care look like. So that has been done and completed. So we need to work with the regions that when there's an outbreak at a site declared, that just like in acute care, we can anticipate 7 to 10 days, there's going to be more activity, higher acuity, and we need to prepare for that. So that needs to happen just like that in personal care homes. It may mean, and we already have put this in place for Maples, but it's something that we need to look at in the future for other PCHs who have an outbreak, that the emergency response team is excellent to walk into a situation and manage IVs and higher acuity and do the assessment and any intervention. So they have done that before and they're doing that right now. There's supervision from emergency response, and keep in mind, always 911 calls take priority, but if there's a community paramedic or an advanced care paramedic who can be made available to these PCHs when they're in an acute situation or they're trending towards that, then that needs to happen in partnership with the region. So the region needs to probably look at what are the medical supports and nurse practitioners on site, just because this is a more intense acute period. The residents at the personal care home ideally would be able to have interventions in place in their home, in the personal care home. It's confusing sometimes for the elderly to have to transport them out, and so we want to meet the needs of the residents where they're at. We need to anticipate in advance, and we need to surge when the need occurs. So we have to work together on that, and we will make sure that that applies to rural and northern Manitoba, not just Winnipeg as well.
From the Winnipeg Sun, Scott.
Oh, good afternoon to you both. Scott Bill here, Winnipeg Sun. Does the province need military intervention, as Mayor Bowman pointed out today?
I didn't hear that. Is that directed at personal care homes? Was that what the direction was?
I think he was talking in generalities, given the situation that we have, especially in the city here.
You know, no, I don't think that would be a recommendation that I would have at this point. You know, I think that we've never removed things off the table, the support that we need, but I think that we've seen increasing cases. We know this is a critical juncture. We do have restrictions in place, and you know, and I think, like I said, we've been discussing today. My opinions were sought on what further restrictions may be required. And as we move forward, I think that Manitobans can step up and will once again flatten this curve, which will you know, improve again, you know, the strains on the healthcare system. It will improve the strains in personal care homes as well. So we have to act now to start bringing down those community numbers, because they really affect everything.
Thanks for that. Have you heard of reports out of Steinbach at the Bethesda hospital there that the situation is dire?
No.
I haven't received any information like that.
Okay. And other question I have from a coworker here is wondering, so Shared Health is concerned about safety of the health workers. Why not at hospitals right now? Assume everybody coming through the door has, you know, it could potentially be a COVID case, and as opposed to having the green, yellow, and red zones of protection?
Yeah, that's a great question, Scott. When we made the guidelines originally, it was quite easy to determine who was a low risk, who was a high risk, and who was a suspect. Now that we see this community spread and we see this trend in healthcare workers, it's definitely something that our team of experts is looking at now, and I'm hoping that we will have refreshed recommendations in the coming days, which we can report to you.
Thank you.
From CBC Radio Canada, Laisa.
Hi, bonjour. My first question will be regarding the death of a healthcare worker at Victoria. I just want to know if the person had the COVID while working at the hospital.
Yeah, I don't have any details on that. We were just notified. The WRHA would be looking into that. We weren't provided with those details, sorry.
Okay. And also, Dr. Roussin, you mentioned talking about Maples, you see 13 deaths, but the information that we have, the note issued by Rivera yesterday was talking about 22.
Let me see here. So you're talking about the number of deaths at Maples?
Yeah.
Let's see what information I was provided. For Parkview Place, they're reporting 23 deaths. For Maples Personal Care Home, it's 13 deaths.
13, you said? 1-3?
Correct.
Okay, because we have another information about coming from Rivera.
Yeah, and so our reports again come from the Public Health Information System, and so some places may be able to report numbers earlier. Ours go through a process before they are reported out. So those are as of this morning from our Public Health Information Management System.
Okay. And my last question will be Doctors Manitoba has been launching a new campaign today, and I was talking to them, and one of their concerns, they was mentioning the fact that the province has been putting in place strategies to increase the capacity of in hospital, but they have not been seeing plans to increase the number of doctors or even replacing in case of heal of a doctor. Is this something that you're working on?
Yes, we definitely are working on it. Our chief medical officer and his team of specialty medical leads have identified that they are going to need extra support as well. I believe they have 100 people who have volunteered so far. And they're working on training and orientation for those individuals. So I would have to know more details and probably refer it to our medical experts.
From CBC Manitoba, Bart.
Hi, folks. We're told today that Thunderbird House can't test any more homeless people because there is no place to put COVID positive homeless people right now. What are you folks doing about this today?
Well, I have not heard that, and that wouldn't be an approach that we would take. We certainly the alternative isolation accommodations is something that we continue to build, but we wouldn't turn away symptomatic people for testing because of that. So it's something we continue to work on, but I haven't heard that detail, Bart.
All right, then. Next question, Ms. Siragusa. As you know, healthcare aides are being trained to take patients' vitals. Normally, that's a pretty technical aspect of what an RN does. How do you think that's going to work when aides are going to be taking vitals?
So it's It's not that technical anymore to take someone's blood pressure. It's actually a machine called a Dynamap. You can buy something similar at Shoppers Drug Mart or the store, where you put the cuff around, you push the button, and you can get the blood pressure and the heart rate. What's important is that it's recorded and communicated with the RN. So the task itself is not that complicated, but the interpretation and the response is what will be critical.
Okay, thank you very much. My last question is for Dr. Roussin. Doctor, given the, forgive me, no other way to say it, failure thus far of incremental addition of restrictions, what do you think of the idea of what, they call in Australia the short, sharp lockdown?
Yeah, and so this is, like I mentioned, my thoughts were sought this morning about certain interventions, and some people would call what you just described a circuit breaker, is how it's been described, and so I think you're right. In Prairie Mountain Health, we did a very targeted campaign with restrictions that worked out quite well. But now deep into the second wave, and we're seeing cases climb throughout the world, certainly throughout our nation, and that targeted approach is again being sought and trying a measured approach. But we're still seeing numbers climb, although we're not too far into this restricted one that we did. But I think we're discussing now just the nature of the restrictions that we need, just because we're in a critical point right now that we need to make change right now on the demand in our healthcare system.
That means the circuit breaker's on the table?
Well, it's never been off the table, but it's certainly on the table. We were certainly looking at what's our next approach right now to ensure we start bringing these numbers down.
From the Thompson Citizen, Ian.
Good afternoon, Dr. Roussin. First question, in the 2 weeks since the North has moved to the orange level on the pandemic response system, the number of active cases is nearly quadrupled. I mean, does that mean that the public health orders are not restrictive enough to be effective?
Well, I think this is the thing that we're looking at, right? We've tried this incremental approach, and certainly in public health interventions, the least restrictive means are always the first attempt that we should do. But we continue to see numbers climb in areas that we've turned orange, and so we're right now evaluating what we need to do to ensure we get those numbers down.
And then just to follow up on that, I mean, what more can you do in health districts like Cross Lake, where the response level is already at restricted, but the number of cases still keeps going up? Like there's been 10 more since Friday.
Yeah, and we look at the timing of those too. That's still within that incubation period. When we get more cases that are contacts, that's to be expected, right? A certain amount of contacts will turn cases. What's important is that whether those 10 new cases had any substantial contacts. That's where those restrictions come into play. So we'll see. That's time will tell whether those new cases have in fact had a substantial amount of contacts. If not, then we'll see the transmission be halted.
And then last week the province said they were going to be bringing some rapid tests up to Thompson and some other places in the north and remote communities. I mean, how is that going to help in the fight against possible outbreaks in the region?
So we know in many of the First Nation communities now that have had outbreaks, they have been using rapid tests, the Gene Expert test, and so that's helped immensely in handling these outbreaks. As we now have access to other formats, Abbott ID, we're hoping that we'll be able to utilize those to the similar means to speed up that case identification, which then obviously speeds up the ability to isolate those cases, and then it speeds up our ability to identify contacts.
Thank you, everyone. This concludes today's media briefing.